Icons 8 Music.
Hello. I want to welcome you back to Sim-portant Conversations at SDState. My name is Patrick Verley, and I serve as your Master of Sim-eronies. It's a pleasure to be reconnecting with our group of simulationists, and really pleased to share with you that today's episode we will be working with and interacting with a number of different members of our interprofessional team, even including those that don't work directly in healthcare per se, but nonetheless are doing some really exciting things, dare I say, sim-citing things to support the efforts and work of our team here at the HCSC and indeed the learning of our students as well. And so I'm really excited to have each one of our panelists tell us a little bit about their role, and again, a lot of variety today with regard to the different members of the interdisciplinary team represented on today's episode. So let's see, Alyssa, would you care to start us off, please?
Sure, I'm Dr. Alyssa Zweifel. I'm the Healthcare Simulation Center Director and Assistant Professor at the College of Nursing.
Hi, everyone. I am Dr. Brandi Pravecek, and I am a Clinical Assistant Professor with the College of Nursing, teaching primarily in the NP program. And then I also practice as a rural family nurse practitioner in South Dakota.
Hello, my name is Dr. Brittney Meyer. I'm a professor in the Pharmacy Practice Department of the College of Pharmacy and Allied Health Professions. And I'm also our college's interprofessional education coordinator.
Hi, I'm Kayla Salonen. I am a clinical instructor with the respiratory care program in the College of Pharmacy and Allied Health Professions. And I also have been and currently still remain an active respiratory therapist in Sioux Falls.
Hi, I'm Mike Twedt. I'm a lecturer in the mechanical engineering department. I'm an instructor for our senior design courses and glad to be participating today.
And I'm Takara Schomberg. I am an instructor in the College of Nursing at the Sioux Falls site. I also serve as the Sioux Falls Simulation Site Coordinator.
So thank you all for those lovely introductions. I want to talk a little bit about something that, I don't think we have really addressed in a prior episode, which is the best practices of interprofessional simulation. Certainly we've talked about how simulation in general should look and what the evidence supports, but really leveraging the expertise of each of our panelists today, I think will be really helpful. And Takara, I don't remember if you recall this conversation, but gosh, it was probably about 2 years ago now when I first started hearing the term healthcare simulation center within the college so often. And in my capacity as a simpleton, I had asked Takara, why is it not called like the word nursing is not even in this. Why would that not be part of the center's name? And she explained to me at that time that, the idea was that this is going to be something that is really taken advantage of by all sorts of different disciplines. It's not going to be exclusive to nursing. And here we are just a couple of years later having this conversation with this interdisciplinary team. And so I was just reflecting on my own learning with simulation and how even in spite of everything that we've been through with the pandemic and stuff, HCSC has really seen its aspirations come to fruition with regard to the collaboration. And I think that's really gratifying. So Alyssa, I was hoping that you could talk to us a little bit about those best practices for interprofessional simulation and garner your expertise on that.
Sure. Yeah. So the Healthcare Simulation Standards of Best Practice, the ANASCL Standards Committee came out with updates in 2021, published in the Clinical Simulation and Nursing Journal. So they call IPE simulation, simulation enhanced interprofessional education. So again, same term that we've been talking about, but that is the standard, really gives us the guidelines of that framework of what do we follow, how do we get those standards of best practices in simulation when we're doing these interprofessional collaborative activities. So we like to really bring that team together. So everybody on here today, has worked with us from the forefront, creating the scenarios, talking about, do we have adequate resources to meet the needs of all of our students before we do a simulation activity with all of us? We talk through what are some potential barriers and how can we overcome those so that we can all come together. A lot of the times we find that it's really scheduling differences. Some of our students are in courses or classes when the others aren't, and trying to find that right time, right place type of scenario to make these larger events happen. And then, of course, we really focus on what are our mutual goals. Setting those mutual goals that all professionals are in agreement with prior to the activity. And then, of course, having clear learning objectives for each learner group. And then, just like any other simulation, we want to have that safe learning environment so our students can learn and critical think and go through motions of things that they need to learn before they get out into practice. And then the other important piece about the interprofessional perspective is really going back to our frameworks. We use a lot of the IPEC core competencies, we use team steps, really having those teamwork and collaboration as our forefront. Those are our core basics of planning before we get into the details of that simulation enhanced interprofessional education. So of course, that's the standard in a nutshell. We still have that, pre-briefing standard and the debriefing standard that we've talked about on other episodes that also need to be followed during these activities, just to really enhance that student learning.
So it sounds like a lot of the considerations that are important for interprofessional simulation are the exact same that we would use in any other type of simulation activity.
Yeah, we just make that dynamic, larger by bringing in all those disciplines and making sure that we, have that mutual goal and mutual objectives, but then the rest of that piece, is following the rest of the standards of healthcare simulation.
Well, and that reminds me of, I think it was our last episode where we talked about certification and how, one of the reasons why certification in simulation is so important is that now, if everyone's certified, irrespective of whether you're respiratory therapy or nursing or physical therapy or pharmacy, you all have this universal understanding of what is simulation best practice. And you're not going to be as siloed now in the way that maybe your particular program does it or your particular institution does it. And there's this universal language and universal understanding of how simulation should look across all disciplines and across curriculum. So I think that the next thing that we want to do is learn a little bit about how simulation has evolved within each of our panelist programs. Certainly HCSC is able to speak to how that's looked at the College of Nursing over the past several years. But I'd be curious to hear about how the experiences of some of our interdisciplinary colleagues maybe is a little bit different, or I suspect in certain ways somewhat the same as our experience. And so I'll open that up to our panel to talk a little bit about the history of simulation within your program.
So I can go ahead and start with that. I again teach primarily in the nurse practitioner program. And so we in some way, shape, or form have really been involved in some type of simulation activity as long as I've been with the College of Nursing. But we definitely have seen that grow and evolve into that interdisciplinary approach that we utilize now. And so for our students, what has really been key when we think about the role of the nurse practitioner is really giving them that safe opportunity for learning as they begin to master that role transition. So all of these students are coming in, essentially many of them as expert nurses, having been in practice for some time. And so oftentimes they know well the role of the nurse in a particular scenario or simulation experience. They know that role so well, but it's really that step they're having to take into that provider role. And so that's really evolved to, like I said, give them the opportunity to really just be able to safely do that versus being out in practice and being expected to do that essentially for the first time. A lot of our focus in the family nurse practitioner program is indeed, we have a strong rural perspective with that and really preparing our graduates to practice in those underserved areas. And so giving them the opportunity to function in that role in a rural setting has been key as our program continues to evolve.
And this is Brittney Meyer with the College of Pharmacy and Allied Health Professions. And I started at SDSU in 2011. And at that time, simulation had occurred. I graduated from SDSU and it was incorporated within my curriculum in, more informal, less structured ways. But when I started, I was kind of tasked with helping assess and develop our interprofessional education. At that time, there was new curricular standards coming out, and that was a major focus. And so we teamed up with College of Nursing faculty and developed some simulations for interprofessional collaboration. And it's been a really fun partnership. So some occurring in our patient care skills lab in like a clinic simulation setting, and then others occurring in the College of Nursing's center with the high fidelity simulation mannequins to facilitate an inpatient setting. And so that's been occurring, close to over 10 years now. And then since then, it's been really great to see the growth of the Healthcare Simulation Center becoming accredited and being able to apply those best practices and making everything standardized so every student across the state gets the same experience. And so since that, with the College of Pharmacy doing simulation for several years, as our college grew to incorporate other professions, we've seen respiratory care get involved with simulation as well. So I'll let Kayla kind of talk about that.
Yeah, so I also have probably a kind of a unique perspective on the Sims as well, as I was a student of this same program when it was with a different university. So I was in those Sims, and it was just with various other different simulation centers and stuff like that. So we never really were involved here on the Sioux Falls side of the state with simulations with the SDSU nursing. We have a satellite in Rapid City that I think in the last few years have been more involved in the SDSU nursing simulation centers. But this was actually our first year on the Sioux Falls side to really get involved with the SDSU nursing simulations, and just being a student, but then also now being an instructor, I will say that it's been quite eye-opening. So,
Well, my name is Mike Twedt. Again, I'm in the mechanical engineering department. I teach our senior design class. And as part of that, we have groups of our students that work on a project. And as a mechanical engineer, we want to make it faster, better, cheaper, stronger, more energy efficient, something better. And so the project centers on taking a challenge and solving that challenge. And so my connection with this is that we've done a couple projects with the simulation center and looking at making a lab a little more lifelike, maybe to quickly summarize it, but doing it on a time frame that we have to fit in and a certain budget that we have to make it as good as possible. So that fits, that challenge fits really good with our class. The projects that we've worked with and teamed up with are really interesting projects. And then also for our engineering students, we have a biomedical engineering minor program. And so the mechanical engineering students that are involved with that want to do something related to this biomedical engineering, which is basically applying mechanical engineering to the human body and solving problems associated with that. So a great link, a good fit with our students. And it works out great. Students love these projects. The centerpiece of that, again, is solving a problem and optimizing a solution to make it as good and as applicable as possible. So it fits really well.
The really interesting part about your engineering's latest project is it's actually an enhancement that is for one of our interprofessional simulations. Yes, we have that interprofessional collaboration going on between nursing and engineering, but then we bring that device into one of our interprofessional simulations where, all the disciplines that are here today actually will get to see that in action. Hopefully next semester is our goal. But that's kind of a unique twist on the collaboration, and then we bring it into an interprofessional sim. So we're excited about that opportunity.
I suppose that leaves it to me. I loved hearing everyone else's journeys towards sim and their programs. Obviously the nursing program has been the default as the instigators of our podcast here, or the hosts, I guess, of our podcast here. But for that reason, our listeners have heard some about how simulation came to be and I would actually refer people back to episode 3 with our simulation techs, where they really gave a really nice history of how it's kind of grown and evolved in the College of Nursing. But I did want to briefly speak to kind of this IP part and kind of build off of what you all had shared. I came to the College of Nursing 5 years ago now and have, or 4 years ago now, and have been part of simulation throughout that time. And it's been really exciting for me as I've come into this simulation site coordinator role and starting to work with our IP partners and collaborating on how to make those days as meaningful as possible for all of the participants involved has been really exciting for me. I've had the opportunity to brainstorm and work with many of the people on our podcast today to talk about, how can we enhance the outcomes for the other learners? How can we improve the pre-brief or the debrief? Which portions of those experiences they would like their learners to be a part of to really get the most out of that opportunity. We hold our simulations to a high standard, be an accredited program, and it's just been so exciting to have more partners come onto that and see that those opportunities given to more and more students. Kind of referencing, Kayla and her students joining us in Sioux Falls this last year, we've seen such huge growth in our students because of that collaboration. And also I know we as instructors have learned a lot as well. We've gained some insight into those other roles. We've gained some insight into how we can increase the fidelity and also have found new opportunities to support learning on the day of sim. So it's been fantastic, and I'm so excited to see where it goes in the future.
Well, thank you guys so much for sharing a little bit of that historical perspective within each of your programs. I did not go to SDSU as a student, and I'm not a simulationist. However, I certainly had experience with simulation as a student, and I know that I've talked to a number of you about, just what my misunderstanding of simulation was. And then when I went to pursue my master's degree in nursing education and actually learned about what simulation can look like, I remember thinking to myself all the time, like, wow, that's definitely not what my experience as a student was. And certainly that was many years ago. So I appreciate that all the technologies and such weren't always available at that time. But I think if we learned anything from the pandemic, it's that we are able to accomplish a lot with some creative problem solving. And I am confident in reporting that each of our programs here within the HCSC is doing just that. And collaboration with one another certainly represents one of those benefits. And so to that end, I want to talk a little bit about what is the reason for why we want to have interprofessional simulation. I mean, certainly we know that the literature supports that. And so, Brandi, do you care if you start us off with what your perspectives on are sort of some of those biggest, most significant benefits of IP Sim?
Sure. So I know I alluded to this just a little bit previously too, but I think when I think about that nurse practitioner student, it really is that focus on that role transition and what that looks like, being able to really essentially practice that in a safe setting that simulation provides. I think a lot in these simulations about my first year as a nurse practitioner a long time ago, and being in so many of those situations literally for the first time in practice, and how scary and overwhelming that was at that time. And so to have that opportunity where you really have not only that safe place for learning, but understanding what each member of that team can bring to you and to your practice, and how that can really augment what you do to improve patient outcomes, I think is phenomenal. The other part of that, if COVID has highlighted anything, I think has really been that telehealth perspective, and how important that is in so many facets of healthcare, but especially in that rural setting. So giving our NP students that opportunity to be that on-call provider, to provide care in that telehealth setting before they're expected to do it in real life, is just tremendous for them. And our students will tell us they leave with that confidence of having had that experience. And again, like I said, knowing what each team member brings. They may be in a large urban facility where there's a very large, healthcare team that they're able to work with, but they also may be in that rural setting where resources are more limited. And that even highlights all the more how important it is to really work with those team members that are available. And again, ultimately to improve those patient outcomes.
I don't want to sound like a broken record, but basically, yeah, everything Brandi mentioned, that a chance to practice skills before actually having to do that out in real life with real patients is a huge plus to simulation. Getting more comfortable testing, you can have the knowledge and you can know what to do, but actually doing it is a whole other story. So that first time getting it out of the way to learn from those mistakes is the really number one biggest advantage to simulation. And then with interprofessional simulation, I think it just packs a bigger punch, because not only do you get that chance to practice your clinical skills in a safe environment, then you also get to learn teamwork and communication with other professionals. So that's what I've really enjoyed seeing our students experience that. And you can kind of never get enough. We have interprofessional simulations each year of our PharmD program, and they learn something new each time with a different nuance or different healthcare professional. So just understanding each other's roles. What am I supposed to be doing in this situation? What is that other healthcare professional student doing in this situation? How do our roles overlap? Or, what else is missing? And how do we communicate that together and work together, to make the best patient outcomes? So I really love interprofessional simulation because it has that twofold outcomes.
Yeah, I definitely agree. But I would definitely say getting the students in and seeing what their various roles are. I definitely saw a difference in confidence, even from scenario to scenario within each day. And we had the privilege of coming for not only a mega code situation where obviously it's chaotic and, everyone kind of gets their pre-established roles and whatnot, but even in, a gas exchange sim where we can show that it's not always, getting in there and thinking, I'm going to go do compressions. It's not like that. We preach in our program that pre and post assessment is just as important. It's we brought in that in a part of one of our learning objectives, because in all of our evaluations, a pre and post assessment, when you're giving medications, you're doing treatments, we preach, watch your preceptors, see what their routine is, learn, find your own routine. And I will say, even seeing the nursing students gain the confidence of being like, oh yeah, that's what I'm supposed to be doing when I go in and do my quick assessment to talk to my patient, find that routine. I will say, even as an instructor, seeing the differences of, how do SDSU nursing involve this in their curriculum? Right now, we just have it as more of a volunteer type of time, where we're looking into integrating it into our curriculum, having it be a part of their attendance, having the prep work, and just making it be more meaningful. They come in and they're like, oh yeah, I guess it's going to be a simulation. There's going to be a mannequin. We might be doing this. We might be doing that. But just the prep work to understand the rhyme and reason of why we do these simulations.
For us on the mechanical engineering side, we do simulations all the time, but most of them are math-based simulations, making mathematical models so that we can do trial and error. But just like what was discussed here, you can do a lot of what-if analysis and cheaply and quickly do a lot of iterations to learn what you need to learn about things. We'll model thermal systems and energy systems and such. For the senior design teams that work with the simulation center, what we're doing is problem solving and largely or oftentimes commonly making a mannequin simulation more lifelike. And so we're applying our mechanical engineering background to that particular problem. And so it's a great fit. Our students learn a similar thing as if they would work in a manufacturing facility, making a process more automated or speeding something up or solving a materials problem. But we'll apply it to this mannequin or the test section to try to make it more lifelike. So our students learn a lot. They learn about the goals of that lab, of that simulation, and try to make it better with additions that they may be able to integrate. So it's great. I think everybody learns. So
yeah, I have to say for our undergrad nursing, we get to work with so many different groups now. I've loved it. As we've added more team members, we've added more interprofessional learning at the Sioux Falls site. And Brandi had discussed this earlier. Our use of telehealth, our use of technology has really enhanced our ability to have interprofessional simulation. Because as you know, the HCSC, the Sim Center, exists across our 4 sites. So in the past, we've been really limited in our collaboration based on location and who was available literally on your site. Now we have the ability to collaborate with the nurse practitioner students using telehealth. We're working on adding some of those elements. We have some recorded interprofessional interactions with pharmacy, and we're really building it, and it's really exciting to see our students learn from that. I think my biggest takeaways, to use the sim term, for our students when we have interprofessional simulation is that one is that they get to find their role as the nurse. Where do they fit in on the interprofessional team? So they have this, what they think is a pretty good understanding of their scope of practice, and then we assembled this team, and now someone's here who is able to do something that sometimes they're asked to do. And it's actually kind of the inverse of what Brandi was referencing, where so often we tell our students, this is a role setting, no one's coming to help you, you have to do it. So then we bring in our IP partners and say, today, though, we have respiratory here and they can do that for you. And so they have to renegotiate kind of what that role looks like and think about how they communicate that role and discuss who does what with these partners. And kind of in that same vein, I see them finding their voice. How do they advocate for their patient? How do they share their unique perspective of the patient and the case? And seeing all the different groups that come together, they'll grow in their overall understanding as they share how they viewed the scenario or what they were bringing into it. And so I think those debriefs when we're all together just are so rich because the students have so much to offer one another in how they performed their assessment or how they organized their tasks or what outside knowledge they brought into the case. And then the last and I guess, most exciting thing that I've seen this last year was them learning to give and receive feedback to people outside of their cohort. Traditionally, they're doing simulation with people they know that they go to class with every day and they go to clinical with every week. And they know and work with these people all the time. And bringing in these partners exposes them to not only the team dynamics in the scenario itself, but then in the debriefing. How do you ask a question of this person from this other background, or who maybe has been in school longer than you, or all these other perceived differences among them. But also, how do you receive that feedback in a way that helps you to grow with that growth mindset? How can you ask good questions and say, how can I improve, instead of taking it as a negative? And those, I think, are really a different set of life skills for them to take into their practice, because they will work on a lot of different teams and with a lot of different people, and they need to be able to speak up when they need something to change, but also to be willing to hear and be humble enough to change when it's needed for the good of the team as well.
Yeah, just to add on to that, Takara, I think that's such a good point. We think about that mutual respect and how important that is when it comes to communication in any type of interprofessional setting. I think about that with our NP students. You know, they've been in that nursing role, so they know what communication is effective, what feedback is effective, how they, you know, certainly everybody desires that respect in their clinical practice. So for them to be able then to step into the role of the provider and model that to the other disciplines, I think is such an opportunity for growth in them, not only just the skill related in the simulation, but like you said, really just that, you know, that life and professional skill set that they'll carry with them then into practice. So that's always good to see as well.
You know, actually, as Brandi, I was thinking too about how I think it's been really fun when we've had these other programs join us at our site. I've been able to see our undergrad nursing students reflect on a different kind of knowledge they have, in that they are very familiar with how we're going to run the simulation. They know, you know, kind of our standards of pre-brief and debrief. They know the setup, they know the equipment. And so then having these other professions join us, they have to think about what that looks like, or how they role model it, or how they orient someone else when they ask for them to hand them something. This person might not know where that's housed. And I often take advantage of that to talk to my students and say, well, that's not unlike when you have, you know, a float come to your unit. Or I can remember like this fall when Kayla had joined us, we had some students, and my students were like, well, they heard, you know, the report, so I didn't feel like I needed to really give them an SBAR. And we had to say, well, you know, they, much like they would in a hospital setting, maybe they got report on a whole bunch of people that day. And you don't know how much time's passed. You don't know how many different scenarios they've heard in the meantime. So you should always be in that practice of giving them that update. And that was really helpful for them. Our students were like, well, I hadn't really thought about that before, that they're not just like standing in the hallway waiting for me to call them. They were doing other things and need me to reorient them to what we, even if we have already discussed it, reorient them to the case and what we need to talk about.
Yeah, I thought with the fall sim, like that was one of the best aspects of it, is that, you know, how Brandi talked about rural settings versus urban and stuff like that. I mean, realistically, a lot of places there might only be one RT on staff, and it might be just during the day. So this RT is, you know, has to worry about all of these patients within the hospital, or they just might not be there. And then in an urban setting, I think it was one of those things that the nursing students didn't realize that, you know, on any given day, a respiratory therapist could be in charge of 3 floors, which could be upward to over 100 patients, compared to, you know, hey, maybe I only have 4 patients today, but coming in, getting a report on maybe only a quarter of those patients, and then being on the rapid response team coming in, be like, okay, what's going on? And they're like, well, didn't you get report? You know, kind of one of those things where, you know, stressing that SBAR is one of those important things just across all disciplines. I mean, that was one of the things in the spring sim that I really liked, is that seeing the how Takara said, that they don't necessarily all have class together. It was really cool to see the interactions between the NP students and the nursing students, because the NP students know, how that report should be, and the nursing students are still learning that flow, especially in a quick situation like that. Also, it was really nice to see the interaction between the NP students and the pharmacy students, just bouncing ideas off on all of the code situation, just that interaction, and then coming to the debrief, seeing that they weren't necessarily afraid to speak across disciplines and be like, hey, I thought you did a really great job on this, then here's something else that we can maybe work on as well. I thought that was one of the great things of the debrief process.
And I want to touch on, Takara, you mentioned the growth mindset. I think simulation in general requires that. And so I always love activities too that can help develop those soft skills, as I call it. Like, you can't go through a sim, you can't fully prepare for anything that could happen. And so you have to look at it like, okay, where might I fail? What am I going to learn from that? I am excited to be challenged versus, oh, I'm terrible, I didn't know what to do. Well, no, you learned from that situation. So I love that supports and helps them grow that growth mindset.
I appreciate you mentioning the soft skills, Brittney, because I think that's the fun part. One of the fun parts about simulation, like they certainly get to practice those psychomotor skills, those hands-on, whatever. But I think they always end up learning more than they thought they were going to learn. And some of their takeaways were not what they thought they were coming here to learn that day. So often, I had someone the other day, they were talking about how they were learning so much about that it's okay to advocate, or it's okay to question an order. It's okay to ask for clarification and find that voice. And here they thought they were coming, they were like, in the past it would have been like, oh, IV, let's start it. Oh my gosh, I can't wait to hang fluids. And so they were having all this reflection on what it means to be in that professional role and what it means to interact with others and
to get comfortable being uncomfortable.
Yeah,
Again,
absolutely.
In simulation before, I'm like, just wait, you'll be in practice before you know it. So
right.
the more you can get familiar with that feeling, the better.
Yeah, I thought it brought in a lot of where, we're all, even in academia or being in healthcare, we're all continuously going to be students. We always need to be asking questions, and that it's okay to ask questions. So I think being able to, rather than floundering and being like, okay, well, where's this at? I don't know where this is at. What do I do? Kind of thing. They learn that it's okay to ask the questions.
And just part of that IPE setting as well, knowing who best to answer those questions. Sometimes if you don't understand your resources or their roles, you don't really know where to go for those answers. So I think that understanding is key as well.
Okay, well, thank you all for that conversation. One of the things that I heard, Kayla, I think you were the first person that kind of got it on my radar, but then we had more discussion. Kayla, you had talked a little bit about how, in your experience, the students are kind of preoccupied with like doing chest compressions or doing the psychomotor skill, and then Takara kind of alluded to how like a lot of times they leave simulation learning all of these things that they didn't even know that they wanted to learn, or things that they hadn't really even thought about. And I know that's something that we've even talked about in our theory courses, particularly med surg content, where I think one of the ways that we can improve some of that content a lot of the time is not focused exclusively on like the life and death scenario, so to speak. Certainly that's a really important part, but then also what are ways to prevent this disorder? What are long-term things to educate the patient on? Because of course that's a really important part of the nursing role too. And we always say that that's important, but then I don't know that nursing curriculum always necessarily is aligned to that. And I always thought of simulation as really being synonymous with like mock code, basically. and that simulation couldn't really be anything besides a mock code. Because again, that was what my experience was as a student, and coming to learn about all the different clinical encounters that you can simulate. It doesn't have to be mega code every time. And I think if you have that narrow of a view on SIM, you really aren't leveraging all of the benefits that it has to offer. So I think that we were able to unpack a lot of that in this discussion, and I hope that I hope someone out there will find that helpful as they reevaluate what simulation is capable of accomplishing, I should say. So that is all that we have time for on today's episode. I want to thank once again our IP panelists for joining us today. We've talked a lot about where each of our different programs has seen simulation within their curriculum, and how they've managed to incorporate it into the learning and teaching for their students. I look forward to reconnecting with our interprofessional partners in our subsequent episode, in which we will be moving and looking into the future and how they see further adoption of simulation-based pedagogies within their program offerings. We look forward to having the second half of this conversation in our next episode. Goodbye, everyone.